I'm delighted to welcome today's guest, retired Lieutenant Colonel David Redmond. He has a wealth of experience in navigating tricky situations. He served for 27 years with the Canadian Armed Forces, tasked with managing many complex missions, including the withdrawal of Canada's UN mission in Croatia and Bosnia during the breakup of communist Yugoslavia. He then went on to become the former head of community programs for Emergency Management Alberta. After that, he continued on as an organizational consultant in emergency preparedness. He may very well be the foremost expert in this area in Canada, and for this reason, I think it's important we hear what he has to say today. So thank you so much, David, for joining me. Really excited to have you on. I've been reading about you, and there are so many questions I'd like to ask you, so I think we should just start and dive right in. So,
thank you, and I'm delighted to be here.
So the first question I guess I would like to frame our discussion, I would like to know, what is the difference between a public emergency and a public health emergency?
Okay, so let's start right away with that. The key concept to understand is, in my opinion, a public health emergency is best used when you have a very small and isolated outbreak, like smallpox or some viral disease in a single community or maybe two communities. When you get to a pandemic, it is all of Canada, it's every province, and it's every community. And so if you're going to declare an emergency, and you only declare an emergency, either public health or public emergency, if you actually need the extraordinary powers that are covered in two different pieces of legislation. So in my opinion, when you see a pandemic, it's going to cover all of your public sector, all of your private sector, every citizen in the province, all your not-for-profits. You need to go for the public emergency and bring all the players together so that right from the start, you make a coherent plan that everybody's involved in. A public health emergency is frequently dealt with just by the medical officer of health in a very small community, and the number of players that have to be brought to the table are very limited. A pandemic's completely different.
So if I am observing the situation correctly, in Canada, we have sort of handled this as if it were as a public health emergency, so we don't have all the players at the table.
Absolutely. Maybe if I can create a visual for you. I want you to figure about 10 to 15 tubes straight up and down. Each one of those tubes is a sector of our economy. Energy. And when you say energy, I'm not just talking oil and gas, I'm talking about the electrical power grid, everything that goes up to getting natural gas into your home so you can heat it. Then the next tube over could be your agriculture. And in there is all your livestock industry plus all your crop industry. The next tube over is your ICT. It's all your TELUS communications, your Shaw, your Bell, everybody that's involved in bringing that into your... Think of all those tubes. Now, in every one of those tubes, there's public and private sector. Sometimes it's completely run by the public sector to a very large degree, more so in our health sector, for example. And others are predominantly private sector. But in each one of them, the regulators are public sector. And so every one of those tubes operates just fine independently right up until you have a major emergency. Now, if you have all those tubes running, and health is just one of those tubes, across all those tubes you have your citizens, then above that you have your municipalities, then your provincial order of government, your federal order of government. And each order of government has what's called an emergency management organization, only one per level of government,
right?
And they coordinate across every one of those tubes when a bad thing happens.
Well,
I want to take you, sorry.
I was just going to say, we've got to cut to commercial, but I want to talk about these, figurative tubes, if you will, but really about where we're headed and what the goal is right after we come back after this break. Stick around.